Hi, Susan. Good morning.
Good morning.
How are you today?
Much better.
Let's talk about why you came in back in July as a patient. Can you tell me some of the symptoms you were experiencing?
My back. I came to get my back worked on.
Back pain or?
Back pain, and then I kept having my neck pop. I couldn't figure out what in the world my neck was popping for. And I've had, because of my spine not being straight, I've had a lot of back pain.
You had you knew you had scoliosis
scoliosis.
still, right? Yeah,
Mm-hmm.
yeah.
So then you had me go to get some blood work, and my blood work didn't look very good. I was insulin resistant. I had a pretty high hemoglobin A1C for being non-diabetic, pretty close to being a diabetic.
Mm-hmm.
And I had tremors in my left hand. Then I've had that ever since I was a teenager. My dad has it, and his brother has it, my uncle.
Let's see what they look like today. Can you hold that out?
It's just so much better. There's still some tremor, but it was like
you were shaking like a leaf when on our first exam, wasn't it?
It was pretty bad. So this is so nice.
This is like frosting on the cake. I mean, it's what you thought was a hereditary problem is actually probably more of a brain-based problem, and
yeah, I didn't have my thoughts being a nurse what it could go into, so I just kept it.
It was knowing what you knew was kind of scary then, wasn't it?
Yeah, just dad.
Yeah. So
I don't really want to be like my dad and my uncle, where they can't use their dominant hand. They have to, like I filled out my dad's checks and then he signs them because he's shaking too much.
So
my uncle can't. They have to use their other hand, like they're right-handed, but they have to use their left hand to eat because they shake so bad.
Okay. So
and that's where I was headed.
You signing your own checks now?
Yeah, I don't write that many checks, but yeah, I don't have to worry.
Your husband's the accountant.
Yeah.
Okay, so we've been. What kind of therapies and treatments have you been doing to help you?
I've been coming here and kind of having that stretchy machine, and then the heat.
What's the name of that?
I don't know.
DTS.
DTS. I've been having the DTS.
Okay.
I've also been taking the vitamins and some of the omega-3s and the vitamin D. That nitric, and I've started slimming down.
Nitric balance.
The nitric balance, I noticed even after a couple of days that my body looked so much better after taking it for a couple of days. It was amazing.
Well, that's to help support the Th3 part of your immune system. So it balances your immune system. And basically, like we just got done talking about how important that immune system is. Mm-hmm. And the brain connects the immune system to the endocrine system, and you can't live without your brain.
Yeah. So I'm improving. It's kind of nice. I'm not really totally faithful to my diet, but I'm doing lots better.
Oh, you just got busted big time. Would you recommend people for brain-based therapy and treatment here?
Yes, because I'm really concerned about all the Alzheimer's and everything that's popping up. We didn't have this many. We had a few. I remember one when I was a young nurse, one patient, and now it's just. As
a nurse, would you recommend this type of care? Would you for a precursory prevention of
yes.
a lot of those neurological conditions that are popping up like wildfire in our age group? Okay.
It just seems like it's all food domination, the processed food, and then we have all these chemicals everywhere, and our body doesn't have a chance, and so it deteriorates.
Are we teaching you how to change your lifestyle?
Yeah.
Okay.
Yeah, it's kind of nice. I'm feeling better. I think I'm happier. I mean, I really think.
Does your husband think you're happier?
I don't know. Sometimes I get down, but I don't know.
But if Bill was here overall, what would he say?
I don't know. You have to ask him.
Well, we need to get him here then.
Okay.
Okay.
I don't know. I'm not going to put words in his mouth because, so when something troubles me, I can't say I'm happy.
Well, hey, life's not perfect. Okay.
But I think I'm feeling better, and therefore I have a brighter outlook on life.
Okay.
It's kind of nice.
Well, thank you.
You're welcome.